Hello, dear students. Today we have the second lecture on general hygiene. Today we consider occupational hygiene. We will talk about harmful occupational factors in healthcare system and discuss and consider main strategies for prevention of its negative influence to human health. You should know that high quality and efficient activities of professional, including doctors, in fact, depends not only the qualification level and equipment and medical institution organization, but also health, their own health, professional health is essential point in high efficient professional activity. As you know, in general, hygiene focused on health. Occupational hygiene is a branch of hygiene, branch of preventive medicine. It investigates how labor process influence on human organism. It's necessary to investigate, to validate hygienic standards and recommendations to prevent occupational diseases because of its negative influence when working experience. Diseases happens because of interaction of environmental factor and human organism. For example, influence of environmental factor leads to disability, temporary or permanent disability, leads to increased frequency of somatic or infection diseases, leads to occupational disease, and in general it can violate the health of future generation, future offspring because of mutations and teratogenic effects. We use the term harmful occupational factors. What is it? Harmful occupational factor is environmental factor, is a factor of occupational environments at working place. It's a part of working condition which can cause occupational disease, temporary or permanent disability because of decreased efficiency, increased ability for somatic non-infection or infection disease. And we need to separate harmful occupational factor and dangerous one. Dangerous environmental factor can cause acute, severe, sudden health deterioration, or even it can cause death. You should know that there are two main types of work, mental and physical. What about forms of physical works? Depends on degree of mechanization and automation. We can subdivide it into several subgroups. The first one, in case of no any mechanization used in factory, it leads to a high level of energy expenditure between 4 to 6,000 kilocalories per day. In case of mechanized and conveyor form used, it characterized with some monotony, the fixed rhythm of work, and rather high level of energy expenditures, about 3 or 4,000 kilocalories per day. Partially automated industry production characterized usage of semi-automatic machines, but person involved directly in this process to control mechanism. In this case, energy expenditure is about 2.4 3,000 kilocalories per day. And as for mental work, when monitor and just observe, and if necessary, to make prompt decision in case of management, some automat and machines. Energy expenditures, the minimal level of energy expenditure is about 2 or 2.4 thousand kilocalories per day. As for mental work related to reception, processing of different information. Usually it requires main attention of our brain, central nervous system, our memory, attention, emotions, sensor analyzers. It activates thinking process and our emotional sphere in general. For example, operator managers, some creative persons, medical staff, and teachers and students like you now. Some terms, as you can see, we use occupational disease. What's occupational disease? What's different between occupational disease and another common disease? Occupational disease is a disease caused with harmful occupational factor at working place only. Occupational poisoning is a type of occupational disease if it's caused with acute or chronic intoxication caused with some harmful chemicals at working experience. Occupational disease can be single cases and group cases. If number of affected persons at the same time, 2 and more, it's considered like group occupational disease. Also, occupational disease and poisoning can be acute and chronic. It depends on the time of its onset and occurring. In case of occupational disease happens after single influence, single contact between employee and harmful factors, it's considered like acute form. To be considered like chronic form, it's necessary if its exposure time lasts more 3 and more shifts. Because of contact with a low concentration, small level, but long time. Long time, 3 and more working days. What occupational diseases are possible and common for medical staff? For example, musculoskeletal apparatus can be deformed and affected, like flat of foot, flat feet, scoliosis, chronic polyarthritis of joints and hands because of forced working posture for surgery during operations. Chronic angiovaginitis on upper and lower extremities because of forced posture, prolonged stay. Varicose veins expansion in the lower extremities. Blood vessels disorders, for example, circulatory disorders in pelvic organs. Chronic poisoning, skin diseases on hands especially, a lot of allergic forms like eczema, fungal infections, pyoderma, nail infections. Some types of cancer happens, infection disease, hearing and visual impairment, drug allergy, progressive myopia in case of strong tension of vision, and psychoneurosis and another psychological disorders if medical staff has a long-term contact to mentally ill patient in psychiatric institutions. So we have come directly to the main goal of occupational hygiene. Its preservation and maintain health and human working performance of employee when working experience. For example, we need to reveal the source of negative influence, reveal the problem, recognize it, who can be affected, and who is exposed to negative influence with different hazards, and we need to provide its assessment, evaluate, make some conclusion to avoid negative influence. What's the practical tasks of occupational hygiene? There are several tasks. The first one of them to create specific standards, special rules, or to maintain occupational hygiene, to maintain health of employee because of special guides and proved specifications of working process. In our country, in healthcare service, we have a special inspection. Preventive medicine officers graduated from preventive medical faculty. It's a doctor who is like supervisor officers who has rights to monitor, to provide inspection of projecting, building, and working objects in industry, in agriculture, and healthcare organization in all spheres of economy. Third point is investigations. It's necessary to investigate the features, specific features of technological process in different fields of industry to reveal occupational hazards, estimate its influence on human body, and create some recommendations to decrease or to full elimination of risk. It's necessary to create special recommendations how to organize labor process, how to organize work and rest regimen in a proper mode. And finally, we need to estimate efficiency of used health improvement, health maintaining actions and measures. You should know that there are 4 groups of harmful occupational factors. It's divided according to its nature into physical, chemical, biological, and psychophysiological factors of labor process. For example, for medical staff, some harmful occupational factors are common. For example, radiation, X-ray radiation, or ultrasound, or ultraviolet or laser radiation, exposure to toxic and allergic chemicals, infection transmission risk, forced working posture, poor light, for example, and stress, maybe visual stress and psychological stress, and to estimate degree of hazard, degree of risk, we need to use some standard level. It's called maximal permissible concentration or maximal permissible level of harmful occupational factor. If we follow the standards during usual daily and weekly activity, 40 hours per week during the whole working experience, it will haven't cause any disease. It will haven't cause any deviation in physiological parameters which can be found if we use all modern facilities among living employee and among the future generations. What is safe working conditions? It's the main goal, it's ideal situation when there is no any harmful, dangerous occupational factors, or if it's present but it doesn't exceed set standard. You should know that there are 4 classes of working activity: first, second, third, and fourth. First class is the optimal working condition when there is no any harmful influence. Second class called acceptable, when we can reveal negative influence, but level or concentration of harmful factor doesn't exceed maximal permissible concentration. If concentration or level of physical factor exceed permitted standard, it's considered like harmful or hazardous conditions. And if we have a real risk to life or sudden health deterioration, severe physical inability at the moment, it's considered like class number 4, and working in dangerous condition are strictly forbidden, except cases when it's absolutely necessary to prevent disaster. Let me give you some example of physical factors. X-ray radiation, radioactive substances, ultrasound, ultraviolet, laser, electromagnetic fields, increased atmospheric pressure, noise, and vibration. Noise is one of the most common harmful occupational factor. There are 2 definitions of noise according to a hygienic point of view. Noise considered like randomly combined sounds of different frequency, different intensity, and its affect human body. And according to sonical point of view, noise is a mechanical wave oscillation of air particles in elastic medium with a small amplitudes. It's spread under any force. According noise frequency, it can be classified like low frequency, medium frequency, and high frequency. According to its temporal characteristics, it can be constant noise, fluctuating in time, intermittent, and pulse noise. And according to its origin, there are mechanical, shock, noise, and aerodynamic noise. What's the general problem of noise effect on human body? Depends on its level of noise. In different noise, there is no any negative influence if noise intensity no more than 30 decibel A. Noise intensity in the range between 30 to 65 leads to non-specific effect of noise. It can cause nervous and mental reactions. And if it's up to 80 decibel A, it can cause so-called non-specific syndrome noise disease. Specific effect of noise, hearing apparatus affection occurs if noise intensity exceeds 80 decibel A. It can be hearing fatigue up to 100 decibel, cochlear neuritis over 100 decibel, and noise trauma can happen if noise intensity above 120 decibel A. How to protect employees and hearing against noise. First of all, we need to improve our environment. We need to eliminate source of noise outside. We need to monitor its technical condition, and if necessary, we need to use some grinders on the desktop to absorb noise and monitor condition of technical equipment regularly. And if it's necessary, we need to use special air plugs and to protect our ears against noise. Vibration. Also, it's example of mechanical oscillation, but in the system with elastic media if some objects close to each other. You should know that there are two types of vibration. General vibration, AF vibration, AF oscillation transmitted through support surface when staying or sitting, and local vibration or arm-hand vibration when oscillation pass to the body through the hands. If deal with the sound vibration generating devices and special tools and machines, and combination when we can reveal both of them at the moment, general and local vibration. Vibration leads to vibration syndrome. There are four stages of vibration syndrome. Initial phase, characterized with pain and hands, lowering sensitivity to vibration. Moderately expressed, it leads to blood vessels disorders, cyanotic skin, hyperhidrosis and intense sweating, pain across the hands. Severe vascular disorders characterized with a spasm of blood vessels and can be called like dead finger or white finger syndrome because of blood vessels disorder. And we can notice severe disorders in central nervous system and cardiovascular system and endocrine and in metabolism. And the last stages of vibration syndrome, generalized disorders characterized with severe disorders in brain and in heart. It's common situation when medical staff deal with ultrasonic equipment. And it was estimated that more than 50% of nurses and more than 75% of physicians who used ultrasonic equipment suffered with vestibular disorders. It can be central nervous system disorders can be found, and especially in vestibular apparatus. And when observe blood vessels of brain, it can be found, disorders can be found after just 5 years working experience. How to reduce negative influence of ultrasonic equipment? You need to follow the created guides, and to organize your work and rest regimen in proper way. You should be examined with regular medical checkups, have balanced nutrition, it will be considered, and some treatment and preventive physiotherapy measures can be prescribed, like hydrotherapy and massage, for example. Rather common technology used in hospitals is laser technology. And laser technology can be rather dangerous and harmful for doctors' eye and skin. And a lot of changes in the body happens because of laser radiation influence. It can be non-specific functional disorder, nervous and cardiovascular system can be found. Also, in the medical examination, except skin and eye disorders, we can reveal some nervous system disorder, asthenic and vegetative syndrome of nervous system, weakness of nervous system, and blood vessels disorder can be found. What about eye affection with laser radiation? It can cause to keratitis in case of cornea affected. In case of crystalline lines affection, it leads to turbidity. It's called cataract. And if vitreous body or retina affected, it leads to scotoma. What about effects of laser radiation on skin? It can cause burns, especially in opened parts of skin. It can affect carbohydrate and fatty and lipids metabolism in skin, especially in case of defocused laser radiation. Also, skin cancer is possible because of ultraviolet wavelengths. As for inner organs, direct or reflected laser radiation can change activity of inner organs, but we cannot feel it. For example, nervous system excitability, some changes in Dechman structure of brain, in blood vessels, increased irritability and fatigue, and intensive sweating and hyperhidrosis, decreased heart rate, fluctuation of blood pressure. Also, laser can lead to appearing of aerosols and harmful chemical substances in the department. For example, aerosols of smoke, soot, liquid, splashes, parts of tissues, air pollutions with tumoral cells happens. And usage of laser leads to appearance of phosgen and another toxic substances from plastic materials under the laser radiation. Light flash happens in visible range of wavelengths and invisible range of infrared laser beam. Ionizing radiation, for example, neutron and gamma radiation, appear because of interaction of laser radiation and with target. And soft X-ray radiation even can be spread from electronic equipment. And laser generating device is a source of electromagnetic fields with noise and vibration, and change microclimate, change air temperature, air humidity, air movement speed. It leads to an increase in concentration of carbonic gas. What's about chemical factor? Chemical factor a lot of chemicals can be revealed in air of healthcare organization and working place, for example, acids, alkaline, gypsum, antibiotics, anesthetics, and another like cocaine and ether drugs, alcohol, disinfectants, for example, some products of incomplete combustion of natural gas. And to estimate its toxicity and hazard, degree of hazard in toxicology, all chemicals subdivided into 4 classes. First class is called extremely toxic. For them, maximum permissible concentration is less than 0.1 milligram per cubic meter. Second class is highly toxic. For example, it can be used in dental practice, when maximum permissible concentration is ranged between 0.10 to 10 milligram per cubic meter. Third class is moderately toxic, also used in dental practice, for example. And fourth class, low toxic, if maximum permissible concentration over 10 milligram per cubic meter. What is the path of entry? Chemicals into human body, for example, through respiratory system, in case of inhalation with air we breathe, through gastrointestinal tract, or oral when eating or drinking something, for example, and percutaneous through skin. It's a common for fat-soluble chemicals. What's the effects on the body according to its target organ? It can affect nervous system, liver, kidney, blood, heart, and several organs. And very specific action of chemicals. It can cause some antibiotics, sulfonylamides, antiseptics, anesthetics, vitamin B group, some heavy metals, acrylates, gypsum can cause allergy. It can cause cancer. It can affect future generation. It can be, for example, gonads, embryon, fetus can be affected. It can cause mutations. It can cause skin and mucous membrane irritation, and it can affect breathing process in case of highly directional action. And as a consequence of chemical factor is the occupational allergy. The most common is for medical staff with increased sensitivity to antibiotics, to some drugs, antiseptics, anesthetics, metals. And clinically, occupational allergy can be found in open part of skin, on face, neck, hands, and one of the most common symptom is urticarial rash or eczematous rash. What is the reasons? What is the most immediate reasons of occupational allergy? They are prolonged contact with drug and harmful chemicals, increased sensitivity to chemicals, imperfect bad equipment and tools, imperfect of use technologies, lack of protective equipment, and irrational plan of clinic. How to prevent occupational allergy? For example, primary, we need to provide selection of persons who are going to be admitted for university or for a job. We need to implement in practice less allergic substances, to create safe working conditions at the workplace, to remove bad working equipment, improve ventilation, maintain proper level of ventilation. We will have a classes about ventilation. We need to organize special room for physiological relaxation. We need to use all modern medical uniform, and we need to supply it with special diet, with balanced food. As I told, to be considered. Secondary prevention involves identification of allergy in early stages. For example, in case of itchy, dry skin, and in this case, we need to transfer affected person to another working position. And we need to provide regular annual medical checkup to prevent occupational allergy. What about hypersensibilic food? How our diet can help us to decrease the risk of allergy. Hypersensibilic food aimed to slow process of allergy, to improve metabolism, to increase body resistance against negative influence of occupational factors, to maintain our health, to increase its efficiency and reduce number of occupational diseases. What's recommended include the diet. We need to eat enough food with adequate amount of proteins, especially contain sulfur-containing amino acids, at the same time with a low amount of histidine and tryptophan. For example, it's advised to eat enough amount of cheese, beef, rabbit meat, chicken, or carp fish. Also, we need to eat enough amount of food rich with phosphatids and lecithin. The same rabbit meat, some liver, heart, unrefined vegetable oil, and sour cream. We need to enough amount food rich with vitamin C, P, niacin, vitamin A, E, K, especially in cold season, and we need to avoid high amount of vitamin B1 and B6 because it can cause some allergy. What also is recommended to include in the diet? Food rich with calcium, magnesium, and sulfur. For example, milk and dairy products, cereals, mineral water, alkaline pH food like milk and fruit, vegetables, and fresh berries, because it's rich with it's rich with food fibers and organic acids. But what we need to limit and exclude from the diet in case of high risk of allergy, we need to remove that food that can increase and synthesize, and it can cause irritation of mucous membranes in gastrointestinal tract. For example, rich with histamine, serotonin, tyramine, and other biologically active substances which inhibit enzymes and for example, we need to avoid eating a lot of egg white, scomber fish, salmon, crayfish, crabs, kidney beans, except green peas. We need to limit intake of tomatoes, bananas, oranges, peaches, some red berries like strawberry or raspberry. We need to limit intake of cacao and chocolate and salted, smoked, pickled fish and cheese and pickled or marinated vegetables. We need to limit intake of hot spices and extractive dishes. For example, strong meat or fish broth or strong soup and gravies and hot sauces based on spices. Limit intake of mustard, pepper, vinegar, garlic, horseradish, tomato paste, cloves, nutmeg, mayonnaise sauce. We need to limit intake of pastries, some scones with cream, sponge cakes, pastries, and other cakes. Let me tell you briefly about harmful biological factors. For example, it can cause some infections like tuberculosis or diphtheria agents, or some viruses like hepatitis, AIDS, herpes viruses, COVID. And you have considered it when microbiology and infection disease. What about psychophysiological factors of labor process? It can be described with labor intensity and severity of labor. Labor intensity, high labor intensity or a low level of physical activity, or forced working posture, high load on muscles and skeleton and to our vision, our mental sphere, leads to psychophysiological stress. So, physical activity, physical work can be described with the severity of work. It reflects our workload on musculoskeletal system, on cardiorespiratory system, which maintain physical movement. It can be described with physical dynamic load, lifted and moved weight, number of stereotypical movement, working posture, body incline, degree of body incline, covered distance in space, and especially we need to focus on mechanical factors, forced working posture. It leads to stress and pressure for some inner organs because of prolonged strain and also prolonged muscle tension related to prolonged strain when surgical operation, for example. It's common for obstetrics and gynecologists and surgeon who must stay during a long period of operation in the same posture. And it leads to stagnation of blood vessels, blood and blood vessels in the lower extremities. It leads to flat feet, varicose vein expansion. It leads to thrombophlebitis, congestion in the pelvic area, blood stagnation in pelvic areas, development of hemorrhoid and other inner organ disorder. What about mental work? Mental work, intelligent work, when we need to solve some problem, perception and assess and evaluation and distribution information, and in case of high altitude and high responsibility for this process, or in case of high number of details for observing, or if it's too small details, that's why we should describe emotional load, monetary load, and mode of work and rest. What's about emotions? Our emotions, medical staff is responsible for the activity for treatment. Is it successful or not successful treatment of patients? And our mistakes and errors, and very significant. It's like on the border between life and death, and we have a highest responsibility in the world for patient's life. Sometimes also medical staff has a risk to their own life. Monitoring loads, for example, the number of stereotypical movements and actions in percents of our working shift, its duration, and our mode of work and rest, our actual working hours, shift work, at night, for example. If we have or if we haven't regulated and breaks and their duration, it's essential. For fatigue is a natural consequence of activity, of physical and mental activity. It can be described, it can manifest with subjective and objective. As what's about subjectively? It's fatigue. It's normal, but and after the rest, our ability to work restored. And objectively, if we provided medical examination, we can find increased pulse, blood pressure, respiratory rate, energy intake, irritability, psychological irritability, some inadequate reactions which can lead to fatigue and stress. How to prevent fatigue and over fatigue? We need to organize our working place in a proper way to make our working environment favorable, to use some all necessary facilities, mechanisms, automats, and we need to set a certain and proper pace and rhythm of work. And we need to enter the work gradually, and we need to try to make our work diverse, to alterate to use different types of activities to maintain our work and rest regimen. Rest considered like changes of types of activity, mental and physical. And to stay active, we need to be trained with the special exercises. But as you remember, we have considered during previous lecture, stress too strong and too long stress, extremely strong stress leads to distress. It can affect nervous system and cardiorespiratory system. It's characterized with increased blood pressure, pulse rate, respiratory rate, anxiety, excitement, because of stress hormones produced. Also, it can cause to occupational pathology. For example, in International Disease Classification, 10th Occupational Disease International Disease Classification, we can find the category Z73, stress associated with difficulties in maintaining of normal lifestyle. It's a disease. It's a consequence of occupational environment. And psychogenic factors, as you can understand, can cause some psychological problems, really. For example, chronic fatigue syndrome and emotional burning out syndrome. What's chronic fatigue syndrome? It's characterized with weakness in muscles, in joints, characterized with sleeplessness and depression. And what is the most common symptom of chronic fatigue syndromes for medical staff? Irritability, but not only for patients, but even for our friends and relatives. And in case of chronic fatigue, medical staff reduce time of patient reception already even at the middle of working day. And when provided official paper registration, sometimes, maybe regularly, we use internal speech. And in our speech, we use some formal stumps and phrases. And when talking with our colleagues, we use a lot of time, a large number of words like fatigue, I'm tired, I'm exhausted. And emotional burning out syndrome is another type of occupational disease It's common when employee works in the system person to person. This term characterizes psychological conditions of healthy people who are included in very strong, very intensive dialogue with other patients, with our customers. And if employee emotionally overloaded atmosphere, and if there is no psychological help, care, and relaxation, it leads to fatigue. But pay attention, fatigue after active work, but not pass. After night sleep, after holiday, after vacations, and the ability of working performance doesn't restore. Personal dispaciousness, irritation to everybody, to colleagues, to managers, to persons, to every person's, and ability to empathy is decreased or absent. And affected persons feel the sense of guilt. There is he feel no achievement. Self-estimation are decreased at the zero level. And he lost efficiency of achievements. There is no sense for them. A lot of psychosomatic disorders can be found. Blood pressure fluctuations, gastrointestinal tract, stomach disorder, neurological disorder, sleeplessness, and senselessness of any events, actually. They have a negative attitude to themselves, and they feel a guilt, and they have a negative mood to their work. If earlier they have business for whole life for them, but actually there is negative mood to their work. Negative relationship to patients instead positive relationship. What is the difference between chronic fatigue syndrome and emotional burning out syndrome? Chronic fatigue syndrome is common for initial adoption of knowledge about the world. Just the at first. And as for emotional burning out syndrome, is common for professionals who has great creative potential, who was initially focused on their work and focused on another person who fanatically devoted to their work. They suffer from emotional burning out syndrome. So, and the main aim of hygiene is to recognize this hazard, to investigate its environment, to protect the employee, to protect the worker against occupational hazard. But what we need to do, what to do to make treatment to avoid disease? We need to provide company need to organize technology in the best way. Absolutely necessary to use a special sanitary and technical measurement aimed to the place, to the source of hazard, to make a barrier between source and employee, and to protect susceptible organism, to protect employee. Also, therapeutic and preventive measures like medical examinations, balanced nutrition, and rehabilitation absolutely necessary. To prevent occupational disease, we need to maintain optimal microclimate to avoid air pollution. We need to provide professional guide in medical university in the final years of education to check future specialists who will be graduated from the university, considering special psychophysiological requirements to them if they are going to work in the most harmful working position with the most strict requirements, for example, in intensive care unit teams or in hyperbaric oxygenation chamber. Selection of students who will be graduated from medical university absolutely necessary. We need to monitor visual, hearing, all organ, cardiovascular, respiratory, digestion, nervous, musculoskeletal, hence venous system. Everything should be checked by medical commission. And medical staff should be must have optimal work and rest regimen. We have to prohibit scheduled surgical operations for surgeon and for anesthesiologist if it should be provided after night or daily shift. And we need to distribute surgical operation equally per week. If any employee has a risk of occupational disease, it should be transferred to another working position. The same is common for pregnant female if they work in surgery and traumatology and obstetrics and gynecology department. But any case, all doctors must be provided with medical examination. We need to check them if they are ready for a job, if they're able, if they have enough fitness to work, to prevent infection disease spread, to provide monitoring their health during working experience, to reveal occupational or another diseases on early stages. It's necessary to prevent, to treat, to provide medical rehabilitation in order to avoid complication and disablement. And as you can understand, there are 3 levels of medical examination. It's provided before admission for a job, when entry, preliminary, periodic, provided regularly, annually, when working experience, and extraordinary is necessary if working condition has changed and if somebody change his working position, department, and sphere of working experience. Usually, preliminary medical examination provided with a special medical commission. It consists of therapeutist, neurologist, psychologist, ophthalmologist, otorhinolaryngologist, special in dermatology. So, medical commission composition depends on the type of working place. Periodic medical examination provided regularly, also provided by commission. Head of the commission should be trained and certificated in occupational medicine. It helps us to reveal early onset of occupational disease. It helps us to decrease the risk of severe complications. And finally, the scheme of occupational medicine mentioned in this figure. We need to review hazard, provided its exposure risk assessment, manage risk, and to confirm and check it and monitor it. Thank you for your attention, dear students. That's it.